Welcome to Fuzzybutts and Friends. Whoop, as much as it drives Fuzzybutts all over this place absolutely crazy when they hear me say it. I am the host of this show, your big dog, Luke Robinson, back with you again. And look who we have back with us again. It's Ginger Morgan. She's the co-host and co-producer of this show. She's also the executive director of the Puppy Up Foundation. Ginger, how are you today?
I am doing well, and I'm really looking forward to this podcast. We're putting a little spin on cancer today.
It's comedy and cancer. The two things just go hand in hand naturally. And so I am too, as you know, and some people know on social media that I've done 2 open mics. I'm going to be spending some time in Austin, probably there. I've been writing a lot, and so I'm excited. Very excited to introduce our guest today. Is Dr. Sarah Boston. She's out of Canada. She's got a tremendous CV, a long list of things that she's accomplished. In addition to a, I think it's a national bestseller. She's an author, a comedian, a veterinary oncologist, a surgical oncologist. I mean, she's done it all, Ginger. But I got to tell you, as I introduce her, I got to start the whole thing with a joke. So I got to tell you, I once was listening to a comedian, and he had just recently been in Boston, and he said, "Man, I love Boston, but I've never been in a place where there's so many intellectuals and idiots in the same place at the same time." And I've been in Boston. I love it. I'm like, oh my God, I love that place. And so I got to tell you, when I'm introducing, it's kind of funny to introduce somebody named Dr. Boston. So welcome to the show, Dr. Boston. Welcome to Fuzzybutts and Friends.
Thank you for having me. It confuses people, actually. A lot of people get mixed up. They think I'm from Boston, or they think I'm American because of my name. It's very funny, but yes. I've been to Boston only once, and I loved it there. So I was happy that my namesake city is a nice place to visit.
So you have been there. Well, I actually lived there for a while. Interestingly enough, my story, this whole story of my journey sort of began there. I moved from Texas to Boston, and I was in Boston only 6 months, and my first dog, Malcolm, was diagnosed with osteosarcoma. This is 2004, and that sent me on my journey. I took him to Tufts and Angel and dealt with all the wonderful oncologists there. It was so early. It's 2000, that's all 20 years ago. I'm sure, as you can, I don't know if you can recall, we knew so little, the amount of research, it was so little, but Boston, I love it. They call them massholes there because they're the most endearing, beautiful people. And so when I was writing this, and when I was preparing the talking points, just writing Dr. Boston made me laugh because it's an ironic place, and I love it. Well, tell me, we've got so much to cover today, Dr. Boston. But we like to start the show with Fuzzybutts. So do you have Fuzzybutts? Tell us about your kids.
I do. I have one fuzzy butt. He is actually at daycare right now, which is good because he would be barking and interrupting. He would be interrupting this podcast. His name's Earl. I don't know. I could show you a picture, maybe. Let me see.
Is he the German Shepherd?
He's not a purebred, but does that work?
There he is.
Oh, he's cute. Very cute.
He's very handsome. That's a superpower because he's a little naughty. Well, he's just got the guardian genes are very strong in Earl, which is good and bad. So, but he's very smart. He's very beautiful, which is a superpower, which is helpful because he's also quite naughty. And then he would like to protect me and my house and my car from everyone.
Car too. That's interesting.
Car, yeah, everything. So we're working with trainers. Actually, I've never needed a trainer in my life. I'm a veterinarian. I've always trained dogs since I was a little kid. I've never needed help, but I'm getting some great help. So yes, and sorry to the mailman.
How old is Earl?
He is October 4th is his 2nd birthday.
Okay.
So, which shepherd people tell me that they settle down, and I'm like, I am just banking on October 4th being like a switch, and that he settles down. Because actually his mom is a healer. So I was expecting, my last dog was a healer cross. So I was expecting the healer personality I got him from a healer breeder because I love that breed so much. And it was during the pandemic, but the healer was a misbreed to the shepherd across the road. I thought, oh, that'll be perfect. It'll be like, more calm. That did not play out that way. And he's basically acts like a purebred shepherd. So anyway, I love him so much. He's so smart. He's so loyal. He's a beautiful dog. He just, like every dog, I think there's things we need to work on. So
There's
There's
always something to be worked on.
there is always something to, yeah, with people too, I guess, right? So yeah.
Exactly.
Absolutely. Well, you can't see it behind Ginger. To her left is her Pete. And he was there he is. There's Pete. And he was,
Shepherd Cross or
Yeah.
Pure Shepherd.
Yeah. Rottweiler.
Lost him to
Okay.
soft tissue sarcoma. Unfortunately, Ginger and I both. Unfortunately, I've lost the 3 dogs I've lost. I've all lost to cancer. And Ginger, Ginger, how many have you lost to cancer?
I think I'm at 8.
Right. So we're
Wow.
we're all in.
I've had a lot of dogs.
Yes, we're a cancer family, so it's great to have you, and certainly someone that a practitioner. So let's start with you've done so much, Dr. Boston. You got so many things going on. I failed to mention your podcast too, although that seems like a new addition to your repertoire of activities. So let's start with your origin story. Where did you begin, this dynamic, fantastic person that you are? Where did you get your start?
So I grew up in Alberta and Saskatchewan. I am like a lot of veterinarians. I decided at 6 years old, that's what I was doing. I kind of went through different iterations of what that meant, but just a lifelong dog lover, cat lover. I think that's the primary. I love all animals, but that was kind of what was in my home and who I kind of got close to as a child. Never really strayed from wanting to be a veterinarian. For a little while, just because I had done a lot of work in small animal clinics, I was like, maybe I want to be a wildlife vet. Maybe I want to do, but then I came back to dogs and cats and decided I wanted to be a surgeon, which is a little bit of a tough road, but that's okay. So did a surgery resident. So I graduated from University of Saskatchewan in 1996, so in Saskatoon. And then I did 3 years of general practice. I did an internship. I did a residency in small animal surgery at the University of Guelph. And through mentorship and also just what kind of interests me during my residency, I just became very interested in cancer surgery. It kind of encompasses all types of surgery, so you don't really have to pick necessarily orthopedic or soft tissue, although it's a bit more soft tissue. It actually speaks a bit to my creative side because every tumor is different and you have to kind of attack things differently. So I kind of enjoyed that, and I enjoyed working with those patients who are usually older pets who've been in the home for a long time that people, really love as part of their family. So I just enjoyed that as well. So I did a fellowship in surgical oncology at Colorado State University. And then I have been faculty at University of Guelph and University of Florida. And currently I am, I guess, kind of talk about my transition, but I was in private practice in the Toronto area. And then during the pandemic, decided to go to comedy school because I was doing stand-up comedy and just decided to try something different. So I still was working as a surgical oncologist during that time, but just a little bit reduced. And now I graduated and I think I got a bit addicted to locuming, which is when a locum is like relief work. And I was like, I finished school at the end of April and I was going to have a job. And then I still don't have a job because I have a home hospital that I really love outside of Toronto. I love the people there. I like working there. And then I've done locums. I was just at the University of Saskatchewan, back where I graduated from, doing a locum. It's quite enjoyable doing locums. You have to meet different people and see how different things are working. And also you have a lot of freedom. So, which has given me the freedom to kind of work on the creative side that I'm enjoying too. So that was more than my origin story. Sorry, that was like everything, but yeah.
Well,
that's kind of where
there
I'm
was
at.
so much to that, but that's so much of you, though. It sounds like you actually did your residency with Steve Withrow, and that's the guy when it comes to surgical.
Yeah,
that's the.
So yeah, that was my my mentor during my fellowship.
You can't, in terms of surgical oncology, you can't go. He's the man. He's the one.
Yeah. I'm very, very lucky. I was very lucky to work with him. Definitely.
Yeah, I met him a few times, and my second dog with cancer was nasal adenocarcinoma, and we took him out to see Steve, and he took a look at the CT scan. He's like, I wouldn't touch that. So, if he would not operate, if he would not do surgery, then it was inoperable. So we had to do radiation. So, but
yeah, it's interesting. Like that's it's funny that you have been thinking about that lately, because I was working with residents at University of Saskatchewan, and I think one of the harder things to learn as a surgeon is when you don't do surgery. So it's not always when you do surgery, it's when you say, you know what, that's not the best thing for this family, it's not the best thing for this pet. So yeah, that's I think fellowship training.
That's a salient point. That's an excellent point. I know a little bit about that because surgeons typically have to have a high degree of confidence in what they're doing. And so have they been pretty effective in teaching surgical resident students that when to not cut, when to not do surgery?
Yeah, I definitely think so. I think it's also something you learn. That might sound crazy, but it's something you kind of learn like with experience of, okay, and surgical oncology, definitely Withrow is the best example, but it always has been a bit about pushing the envelope, trying things. And sometimes that's clients pushing us, or pet owners who say, well, I want to try, I want to see, and as long as it's reasonable and we're, my primary focus is always the patient, not the client, if that makes sense. Like it's their care, I'm their doctor, I'm not the client's doctor, I'm the pet's doctor. So their comfort and what they're going through is my primary kind of focus. But then there's always someone attached to that who's making decisions and kind of the agent for that pet. And so you want to take everyone's needs into account. But if I have to, you didn't ask me to, but if I have to rank them, it's always pet first, and then the client and kind of their wishes, because you've got to think about, I talk to my clients about the cost, and I'm not talking about money. I'm talking about the cost to the pet of what cost is for them to go through, and it needs to be worth it. Again, I'm not talking about money, I'm talking about what they're going through and the benefit of those procedures. So yeah.
I wish I heard that a lot more. And that was so perfectly said. I'm my pet's doctor. So, as opposed to, I'm not here to cater to pet parents, because I'm sure, as you know, as a practicing doctor, that pet parents can have all sorts of misplaced beliefs, and also not have a correct understanding of medicine, or just not understanding. So many pet parents just need good guidance and pathways. And I feel like that some veterinarians, they cater to the pet parent, not to the pet, not to the companion animal itself, and it's the reminders like, hey, well, that's they pay the bill, but they're not the patient. They pay the and
yeah.
It's a really important dynamic, because a big part of your job is an educator and also a cheerleader. You also have to encourage them to make the right decisions, the right medical decisions, because I'm sure, as you know, in the age of the internet, there's so much misinformation and disinformation out there, especially about cancer in dogs. So it's a tough dynamic.
Yeah, and it's funny. I don't know if it's just because I'm getting on in years of practice, but clients are always like, what would you do if it was your dog? And that was like, veterinarians, we don't touch that. We're like, it's not my dog. I don't know your situation. I don't know your financial situation. I don't know what your needs are. I don't know. I've just noticed the last couple of years, I'm like, this is 100% what I would do if it was my dog. And I'm like, I don't know why I feel licensed to do that, but I've noticed a change in me that I sit back a bit. But if anyone wants to ask me that question, I'm like, yeah, if this was my dog, I would do surgery. If this was my dog, I wouldn't do surgery. And they don't have to listen to me, because I'm there to provide options. And the only option to me that's not appropriate is that animal suffering. So they don't want to do surgery and they choose to euthanize when their pet's quality of life declines. That's okay. This is not for everybody. It's a huge commitment in time. It's a huge commitment in money, especially cases that don't have a good long-term prognosis. Some families, they don't want it. It's not even money, or maybe it is. They don't want to do that, and they don't want their pet to go through that. And I think that's okay. So that is an appropriate option. I always talk to clients about that option. And then I'll talk to them about big surgeries if I think it's appropriate. I'll talk to them about other more palliative options for their pet. But for me, it's just never an option to let animals suffer. Like, it's never an option to not address their pain or not address their quality of life. And I do really feel like when their quality of life is poor and we can't do anything to help that, we have to be an advocate for them and choose a path that's going to relieve suffering. So that, but for me, otherwise, everyone chooses things for different reasons. And as long as we can keep the pet comfortable, I'm on board.
That's right. Well, we had two surgeons here in Memphis, and they're polar opposites. We have one who is super arrogant to the point where it's almost reckless. So I asked him to do. He took a mast cell tumor off my boy, and I asked him to do radical. I was being funny with him, and he was radical. He took a lot off, but he was very, very arrogant, and that's very typical in surgeons. And then we had another one I dealt with that took a mass off the vocal cords of the Indiana, the fuzzy butt that Ginger just showed you. And he was the opposite. He was supposed to do a couple of other procedures, and he was like, well, I don't really feel comfortable doing that. I haven't done that in a while. And he had like zero confidence. And it's just like, I don't really know. Until Ginger was like, I don't know what to do, because you have two surgeons and here that you have access to locally. One super probably recklessly confident, and the other one you wish had more confidence. So there's kind of you hope that there's a balance, because you do want your surgeon, your practitioner, to have the degree of confidence, but also have the humility that, hey, my understanding of medicine is still quite limited, and there are risks, and also be there to deal with pet parents like me, who is almost always a wreck when you're dealing with cancer in your dog. So
yeah, most people are in my experience, most people are. Yeah. Most people are a wreck. It's pretty tough. I mean, it's pretty difficult, right, to go through that. It's pretty stressful. So
yeah, well, that's how I find my humor, and that's kind of that's my darkness. That's where I find my darkness. We'll get to that. That's where I'm going towards. I can't wait till we get there. But you said a second ago something that fascinated me. That you don't actually have a practice, but you're doing telemedicine. How is that working in Canada? Has it been successful? And are you doing telemedicine for cancer patients, or just general medicine?
So I'm doing, I got really involved in telemedicine during the pandemic because we had to, right? And I was kind of interested in it. I guess in that context, it was more, people are coming in to see a surgical oncologist. They're stressed to the max. They don't know what's going to happen. They don't know what's going to cost. They've taken time off work, and I just found, like, I was exploring telemedicine, and people were driving 2 or 3 hours, and it's a huge deal, right? And I just thought, if there was a way I could talk to those people ahead of time, go through the record, look at their pet as best as you can, over video, and then tell them what I think's going on and what I recommend and what it's going to cost. And then they can make a plan, right? They can say, I don't want to do that CT. I do want to do that CT, because people would come in, and I don't know, it's very hard to understand as a client, but you come in and one client wants a CT now, one client wants it not now, but they want it, and another one doesn't want it. It's really hard to schedule that. So some people come in and they're like, well, I'm here, I want the CT now. And you can't do it because there's other departments in the hospital, like you don't have the staff or you don't have the availability, right? So if I do telemedicine, I know who wants what. I know ahead of time. People are prepared, and they know they want a CT. Great. They come in at the day that we pick. They're scheduled for a CT. It's happening. They know what a CT is. They know that their pet has to be either lightly anesthetized or heavily sedated for a CT. They know the dog has to stay there for the day. They understand. They know what it costs. So for me, that's a beautiful way to do an initial consult with someone, because so much of cancer medicine is talking about prognosis and costs and what we're going to do and how
outcomes, right?
Yeah, and how we're going to work it up. So that I can do over telemedicine. You don't need to come in to see me. Now, I do need to get my hands on the pet, but during the pandemic, that's how I did it. So, and it was interesting because other veterinarians were like, how did you get clients to agree to that? I'm like, well, I got, it was basically like, you have this consult on telemedicine or you don't get one. Because we were on lockdown. So it was like,
right,
pretty easy. And actually a lot of older people really appreciated that because they were scared to come into a facility. So so I was a very early adopter of telemedicine. Now that, things have opened up, I'm not really doing it as much in that context, but it's more just to do consults. I will say veterinarians as a group have not really embraced telemedicine. And now that we're opened up, a lot of vets are like, I don't want to do that. And so there's pockets of veterinarians who are really into that technology. I'm one of them. There's a few different veterinarians who really love that. But what I hope to use it for is if it's outside of Ontario where I'm licensed to practice, I can't do a direct consult with a client, but I can do a vet to vet. So I can help a veterinarian with their management of a case. And then if it's someone within Ontario, I can do either vet to vet or vet to client. Because of the way the rules are, I can't just tell someone, oh, you need a CT, you need this. If they're in Ontario, I have to have somewhere, a facility where they can come and do that. So I can't just, so it's kind of a side thing that I do. It's not my main practice. I do really like it. But it's not exactly on fire.
Well, I think it's excellent that you do that. And that's specifically why I want to talk about it, because I don't know, we'll talk about what it's like in Canada, but here in America, we have less than 600 board certified veterinary oncologists. That's way, way unacceptably too small. I talk to the higher ups here in the veterinary oncology community all the time. We need more board certified veterinary oncologists, because here at Fuzzybutts and Friends, we're always telling pet parents, you know, it's only a couple $100. You've got to go see a board certified veterinary oncologist. It's worth it. They'll have a discussion about all the outcomes, all the treatment options, and I love GPs, but they don't typically have the wealth of knowledge and data and the corpus of information that to be able to advise the pet parent intelligently. So I'm a big advocate of telemedicine, especially when it comes to specialties, right? You know, cardiovascular issues, and obviously cancer, because here we have within the Puppy Up family, which is all around the country, it's all around the world actually, you know, we have some of our Puppy Up people that have to drive 6 to 8 hours to get treatments, to go even see a board certified vet. That's a real burden an obstacle for their pet getting the appropriate treatment. And like you said, heck, they can run all the diagnostics locally and get that data to wherever the board certified veterinary oncologist is. The consult is the absolutely most important factor, because you shift more to the practitioner, to the educator and the cheerleader, because you're advocating a treatment option that is, like you said, with the best interest of the patient itself, that has the potential best outcome. So you could do that remotely. You could do that successfully remotely. And so I'm a big advocate. I'm glad you're an early adopter, but I find it ironic because we have somebody here doing that in the States, and that is Dr. Venable. And she's also a Withrow.
Yeah.
She's also a Withrow resident. She's also, is she a surgical? I guess she would be a surgical oncologist.
She's a medical oncologist.
Medical oncologist.
Which is actually, you know, to be honest, it's a little more for what she's doing amazing work. And she's sort of helping to kind of bridge that gap. We're short of veterinarians across the board, right? We're short of every specialty, primary care vets, emergency vets. Like, we are having a shortage, and it's worldwide. Actually, it's in America, it's in Canada. Every hospital is short. So I don't know, we're not going to be able to solve that problem quickly. I think telemedicine might be a bridge, and her work is wonderful because she will continue to work with practitioners, you know, kind of work through the chemotherapy. And she's kind of the, she's there, but she's just virtually there, but she's there through the case. I'm a little different because surgery is a little hard to do.
Right.
Surgery is a little hard to do remotely. If I could figure that out, if someone is listening and is can help me with that, that's what I need to figure out, because I'd love to be able to I don't know, zoom in or pop into practice and help them with their surgeries. But I think her work's really important. Because that's the bridge. It's not practical for a lot of people to drive 8 hours for their chemotherapy treatment. I mean, people do it. Those people are amazing. Other facilities I've been at, people move to Colorado for a month or whatever they do. They probably have the means to do that, or that's their fuzzy butt. That's what they're going to do. But most people, that's very difficult. So we need a bridge. I'm a surgeon. I do surgery to treat tumors, solid tumors, or help with the workup, make decisions about what is appropriate for treatment. Whereas Dr. Venable's work is, she will work through chemotherapy treatment or work through treatment options with people. So super important what she's doing, for sure. Yeah,
I've forgotten she's a medical oncologist, but she was, when I met her, that's when I took Murphy to Colorado State, and I met her through Withrow, and so I was working with her.
Oh, okay.
Yeah. That's how I know Dr. Venable. She's great. We had her on the show to talk about she doesn't call it telemedicine though, Ginger. What is it? Teleconsulting, I think, is what she calls it.
Yeah, there's a different terminology, because telemedicine technically is I'm going to say this wrong, someone's going to correct me, but I think telemedicine is technically vet to client, and that's not what she does. She works with the veterinarian.
That's right.
And that's, again, because of licensing, but also you can't administer chemotherapy over Zoom. So she has to have someone there to kind of work with. But yeah, I mean, I think that helps primary care veterinarians as well, so that they know what to do. Because I've had people say, you know, I've spoken at conferences and had veterinarians say, like, you know, how can I get CE on how to treat this cancer, this cancer? I'm like, you know, you can do that, and that's great, but you're never going to be able to keep up the way a medical oncologist is. So you can also bring in a telemedicine doctor to help you with a case, and then you're actually going to learn just by doing and keep up with it by doing. And I think our clients are and patients are better served that way. So
that's excellent. That's good to hear. We need to do that more here in America for all of the reasons aforementioned, because it doesn't seem like the industry, I guess that would be ACVIM that does the board certifications. It doesn't seem like that they're motivated to increase the available pool of board certified veterinary oncologists. And unfortunately, it comes down to a matter of economics. And that's when my interests collide with them, because I'm a pet parent first and obviously not an oncologist. But we're hopefully the regulatory issues will work themselves through here in America to help, like you said, solve the labor shortage is really what we just don't have enough people to look at. I mean, I don't know about Canada. Let's talk about that. But right now we're thinking, I think right now, Ginger, I think the number everyone's going with is 6 million new cases of cancer in dogs alone in America, I think, or is that North America?
Correct. Yeah, so that's correct. And 6 million for cats as well. It's 6 million for dogs and 6 million for cats.
So even
or 11 dogs and cats are diagnosed with cancer every minute.
Yeah, so we know most of those go untreated. We know that, but even if we're going to try to treat some of those aggressively, we need a larger population of practitioners, and it's just going to take time to do that. And so I'm a big fan of telemedicine. So congratulations on what you're doing in that regard. I'm chomping at the comedy, but before I do, because I do love the science, I do love, and that's aside from the comedy, losing 3 dogs to cancer, this is really what I'm about, is trying to educate pet parents and help them when they get the horrible, terrible diagnosis of cancer in their loved ones. So before we get to the funny stuff, let's talk about your areas of interest in some of the research, because I went to your website and I noticed amongst all the other wonderful things that you do, you've been a principal PI in some research. So talk about some of the studies that you've worked on, Dr. Boston.
Yeah, it's been pretty varied. I'll be honest. I never had a lab when I was in academia. I never had like, oh, this is my lab and I do this. Most of my research is clinical, and most of it really comes out of like, I wonder what's going on with this, or I wonder if you can do this. And so I don't know. I joke with some of my trainees that I like to start things. I'm like, oh, hey, what's happening with lymph nodes? And so I worked out a technique for lymph node dissection in the neck. And then like a lot of people have done more and better research on that. And I think that's awesome. Like, I'm like, great. But then I'm like, oh, like what's going on with this? So I think I'm a very curious researcher. I try very hard, and I won't say I always achieve this, but I do try very hard to, especially now, focus on things that either a primary care veterinarian or someone in my field can use. Like, yes, you should do that. No, you shouldn't do that. So I've done some work with limb salvage. Stereotactic radiosurgery got really popular, and it still is, but it was like really popular, I would say, about 10 to 15 years ago. And it seemed like, you know, they were always trying to replace surgeons. So I was like, well, this is it. We're going to do this. You know, we're going to use this high dose radiation, and it's fantastic. It's amazing technology. However, the fracture rate for that, so we're talking about dogs with osteosarcoma getting treated with that type of radiation, is really high. And so then it's like, okay, how do we solve that problem? So I did a study basically looking at treating, like preventing fractures or treating fractures or, you know, impending fractures by plating them ahead of time. And it didn't go well. I'll just say that it didn't go well. And I published that paper because I don't want other people to go through the same iteration, because like a lot of us will have parallel thought, right? I don't want another hospital to get stereotactic and be like, let's try this, let's try this. I'm like, no, that needs to be out in literature that doesn't work. We can't do that. If a dog has, like, we have to pick better candidates for that treatment. And if the dog we choose that treatment and the dog fractures, we have to amputate or euthanize the dog. And we can't mess around with plating because it doesn't work very well. And it's not good for, again, it's for me, it's the patient. Always, that's my compass. So I and then other things
Well,
I like to do.
hold on before you move on, because you have a lot. You're a wellspring of ideas, and I have to stop you before you go too far ahead of me. So let's stop with that, because I love that idea. I love what you said. I love what you said, that there's some things we just have to rule out, and it's one of Elon Musk's principles that I admire, and to the extent that I've learned about him, and he talks about failing fast, fail often, fail fast.
Oh, I like that. Yeah.
But one of the things that we have is, we have so little money to do research in veterinary oncology. So people tend to think of big studies, big clinical trials, big this. And so much of the little things, little questions you have. Hey, what about this? What about this? Those things get ignored. They get left out, and they're never answered. And so I think that's a wonderful strategy of just saying, hey, this is something that we need to know. We don't have to invest a lot of money in it. Let's just figure out if this thing is going to, let's just do a quick study and see if this is a go or no go type of situation. And I'm not sure if you know about the Puppy Up Foundation, but we've funded comparative oncology studies as well. And I don't know what the total amount is, but we've funded several hundreds of thousands. I'm not sure if it's over 1 million yet. And the total number of studies that and I'm not even sure what the total population number of dogs that we've had in clinical trials. So we know the process, and we also know failures, or failures in the sense, Dr. Boston, that you don't get the outcome that you wanted, the expected outcome or the anticipated outcome of the study. But that's okay. Like you said, it's tough for me because I don't like failing, because I grew up with that mentality in Texas. If you got to get on the football field, and if you fail, you're a failure. I grew up in that old mentality, that old school mentality that all of us have, that failures are a bad thing. And it's so refreshing to see a new mentality. It's like, no, failure is how you rule things out as quickly as possible. And the faster you can fail, the faster you can just cross that off the list and move on to the next one. So I didn't want that lost.
All right. No, it's a good point. It's a good point. No, and that's why I published it, because people, and then other things I've looked at, a study I did a little while ago, moving into the private practice space. So if you're in academia, there's a big fridge full of blood. And when you're in surgery and you need a blood transfusion, someone just goes to the fridge. It's just magic, right? But in a private practice setting, no, it gets used up. And so I started doing what's called autologous transfusion. So if you came to me as a client and I'm doing a surgery that is high risk for that patient bleeding, your dog donates blood to themselves. So when I'm doing the workup, they donate blood to themselves. I have that blood. It's only for that dog. You can't use it for another dog. And then when they come back for surgery a week later and they need blood, they get their own blood back. So pretty simple study, but helpful, I think, and also practical, because, trying to get blood is really expensive too.
Right,
so blood transfusion can be $800 to $1,000. And it makes us tentative about using it, because as soon as I pull the trigger on that, your bill is $1,000 more. Whereas if I've taken your dog's own blood, there's still a cost to it, but it's not anywhere near that. And so I'm a lot quicker to give them back their blood, because otherwise it's going in the garbage. And so I find you just were like, yeah, they need some blood, let's give it to them. And they're not coming out of surgery anemic, which is actually a really good thing. So I like studies like that. And then the other one I published fairly recently, it's a little bit older, that's quite controversial, is looking at what's called radical mandibulectomy in cats, which for squamous cell carcinoma in cats, typically people say you can't do that. Yes, you can. Actually, you can. It's not for the faint of heart. Not every cat does well with it, so I don't sugarcoat it. But some of them can have a really good long-term survival with dedicated clients who are going to do the work, and it should be an option that's given to people. I just read a path report on a telemedicine case, actually, that the pathologist wrote. It was for a cat with a squamous cell carcinoma, and the pathologist wrote on the report, "This is a highly metastatic disease," which it's not. It's highly locally invasive. It's not highly metastatic, and surgery is not an option. And I was like, wow, that shouldn't be on a path report. And that information is old information. It is an option. We need to diagnose it early and treat it early. That's really important, because you don't have to take as much job. But some of these cats can do well, and we shouldn't just shut it down as an option for people. So anyway, I wrote an article on that. It caused a little bit of a stir. Someone wrote a letter to the editor that it wasn't ethical. So that is very interesting to me. But yeah, that's the kind of research I like to do. So I'm not in a lab doing, that kind of research. I don't do vivisection research. It's not for me, but I like clinical research. And yeah, that's what I
don't like the term because it's silly, but it sounds like you have passion projects. That's a silly term, but it sounds like you have.
I think that's true.
Yeah, to me, that right there is a great example of an interesting but relevant and important study to a small population of people that have a cat that has a type of cancer that they have the very real issue of, I don't want to can I remove part of the jaw, and or how invasive is the oral surgery going to be, and so it's just I love what you're doing, but we're going long on the cancer and short on the comedy.
Yeah, let's go to the comedy. Let's get to the
comedy because we talk a lot about cancer. Let's go first to this wonderful newsletter you have called the Cageliner, which I love how you call it. It's like the Onion for veterinary medicine news. So tell us the inspiration. Tell us about the Cageliner.
Yeah, I mean, I love satire. I love the Onion. I have to say I've been neglecting it a bit because like I said, I get into my little projects. So sorry to anyone who loves the Cageliner that I've been neglecting it. Really, it kind of is a good bridge to the comedy. I'm sure you guys know this. Not just oncology, but just the veterinary profession it's a very stressful profession. It's I love it. I don't know what else I would do, but it is stressful. And I think we need to pay more attention to wellness. I graduated in 96. That was not a thing when I graduated, right? People just suck it up. Basically, that was the wellness talk. You just do it. I don't think that's good. I'm glad we've kind of moved away from that. I love millennials for that reason, because that's the generation that was like, I don't think this is okay. And I'm like, actually, yeah, you're right. I guess I'm Gen X. I'm like, you're right. This isn't okay. So but I can't talk about wellness because I don't do those things. I don't take breaks. I don't I can't, get in a panel and tell people how they should live their life because I'm doing all the things wrong. But I can tell people, hey, you know what? The thing you just went through with whatever that was, like there's a vet in Australia who just had the same day. And there's a vet in the UK who had the same day. And there's a vet in Tennessee that had the same day. And if you take a step back out of yourself, it's funny. Like, just find a way to find it funny, because otherwise you're going to be crushed. And so, honestly, the comedy, like, there's a few different ways I came into it. I'm also a thyroid cancer survivor. And that's where my book came out of. And the book is funny, even though, I'm like, oh, it's a funny book about when I had cancer, but it's funny. And that's how I dealt with it. I mean, I just found the funny in the absurdity of what I was going through. And so I really believe that's important for our profession. And so whether it's through my writing, the Cageliner is also just satire, which it was really cool when I started it, because I would see in the comment section, like, people tagging each other, or this just happened to me, or this is not even a joke because it's real. And I love that. I love seeing that. It's like, maybe someone's having a crap day and they saw my stupid post and it just made them like laugh for just a second. And I'm like, perfect. That's all it needs to do. So yeah, that's a Cageliner, which has been severely neglected this summer due to me being distracted with my podcast, but I'll try to get it all back on track.
Well, you speak to something very real, and as affliction, I myself, I didn't understand because I don't come from it. I'm not a veterinarian, and I'm not a healthcare worker, and I wasn't really a dog guy before an ex-girlfriend gave me my first dog that I lost to cancer. So she gave me a dog that I fell in love with that died from cancer, that broke my heart. And then that set me off on my journey backpacking 4,250 miles across country, and then losing a couple of other dogs to cancer. So it set me on this really, really, really strange journey that I seem to have been on. And so I understand compassion fatigue, because I kind of think, actually, I probably I have seen, or I see or meet probably as many cancer dogs as veterinary oncologists, because I travel for the foundation. We have puppy up walks all around the country. So we have just cancer. So there's not, the day doesn't go by in my existence where there's not cancer and dog. Those two things don't enter my world. And I got to tell you, Dr. Boston, I had no idea how emotionally impactful that really is over time, because I was ill prepared for it. And Ginger can speak to it as well, because Ginger comes from the world of rescue. Ginger, if you want to talk about that, that's compassion fatigue is very
yes. And like you said, there's not a day that goes by that somebody, I hear about somebody's dog getting diagnosed with cancer or a person getting diagnosed with cancer. Sometimes it is totally overwhelming, and I just kind of shut down, and it's that compassion fatigue, and it's real.
Yeah.
It's very real. I would say, I think I wait until like after Christmas, after the holidays, and then I shut down in January. I take the entire month of January to just kind of reload for the rest of the year. And I know a lot of people can't do that. And it's not that I totally shut down, because I still get those emails, or I see a post on, Facebook or Instagram or now TikTok. We have all these different methods, for the non-veterinarians that we get them. It's all the time. So sometimes I just have to take a break from the social media side of it and answer and be concerned about the people who are, contacting me because of the Puppy Up Foundation. But I don't see how a veterinarian can walk into one of those exam rooms and continue to say, I'm sorry, but your dog or your cat has cancer, because when you walk in there that person's going to be devastated. And I know that, you get happy. There are happy outcomes, from that, and life expectancy sometimes are way longer than what's, expected, but it's got to be a hard thing to do for veterinarians.
Yeah.
And it's not just cancer, but yeah, it is.
Right.
It is,
exactly.
Yeah. But I mean, that's where being a surgeon is pretty fun, because a lot of
you don't
times
have to tell them
people,
that.
I do have to tell them, but I get to cure a lot of cancer, and that's pretty cool. Yeah.
Well, actually, what you do as a surgeon is sometimes you make it somebody else's problem. You get to cut it out and say, "Okay, I'm done with that case." Now it's on the hands of the medical oncologist or the radiologist or whoever. So one and done. I'm done. So, but I love that. I love the fact that you try to keep everyone grounded, because I love what you said is that you can only let that sadness go down so far. We have to be able to function. We have to take care of ourselves to a certain extent, some better than others. So it's and humor is absolutely the best way for us just to break that tension, to break that stress, and to comedy and my kids, my Fuzzybutts, are the two things that I live for. So let's get into let's start about comedy, because I want to get to your podcast. I know we're pressed a little for time, but so you got into comedy during the pandemic? So what was the inspiration just to get up on stage? Tell us about that, because it takes a lot. You're very comfortable speaking. You're a very dynamic, ebullient person. You're a big, large person. I could tell that. But what got you? What gave you the impetus to get up on stage for the first time?
Yeah, well, I think because I do so much speaking at conferences, so I never really was nervous about that. Like I know people have the stage fright or whatever, but I just, because for my whole career was speaking at conferences, like surgery conferences or veterinary conferences, so there was always jokes in my I was like, the first thing I would do is be like, okay, where's the jokes? Which that's the easiest crowd in the world is a conference audience, because they don't expect a joke. So they're like almost just like they're just laughing because you did that. There was also serious content. Serious content. I did get a little bit as a resident. I was told that wasn't good. I shouldn't put jokes in, but I firmly disagree. I still disagree. I think it's a great way to teach is to have humor. So that's always been a part of me. So it was kind of a natural transition. I wrote a book called Lucky Dog, which was about myself having cancer, but also about treating cancer in patients. But it was funny, and I was like, hey, I like humor writing. Like I just kind of realized that about myself. And then when I was living in Florida, I started taking online Second City classes, just like sketch writing, or actually because I wanted to do a satirical newspaper, I took the Onion writing, and I took bunch of classes. And then I moved back to Canada and in the end of 2017. And I was like, oh, there's a second city right here in Toronto, and I can actually go in person. And so then I started doing improv because I thought that was cool. I think improv is amazing for a lot of different reasons. And then I kind of found a stand-up comedy class, and I didn't even know that was a thing. I was like, oh, I'm going to do that. And then people get kind of hooked. It's a little, I mean, you're just starting, it's a little bit addictive, is like getting the laugh and getting up on stage and trying to write jokes. And so I started doing that. And then I literally just was like, okay, I really love this. And so that probably like 2018, 2019, I started doing just open mics and shows, like, but I really loved it. Like I would like drive an hour to do 5 minutes. And I was like, oh,
wow.
So yeah. And then just kind of through the pandemic,
yeah,
I found out about Humber, which is a college that does a comedy program. It's like performance and writing. And yeah, I remember my husband came home, it was like December, he came home and I was like, there's a comedy school. And I was like, the applications were due like very soon. I was like, I didn't apply for this. And yeah, I have no regrets. So yeah, I don't know. It's just, this whole other side of my brain gets fired up, which I love.
Well, it's just like, it's really, like you just said, it's getting up and talking, is sharing a story, sharing a perspective on life. It's that's the simplest, most basic way to look at it. And comedy is that you have the fact that you just want to, the audience, it's more about engaging the audience with comedy. But have you headlined a show yet? What's the longest, how long have you been on the longest? 15 minutes, half an hour?
I've done I think the longest was this summer at a veterinary conference. I did 35 minutes.
Of comedy. You did 35 minutes of comedy.
Yeah. Good. And mostly
wow.
veterinary specific. That's been the other thing. Like when I first started, I was just a lady on stage. I was not a veterinarian. And then I was like, I'm going to start talking about being a vet. And like, the one thing is, as a veterinarian, like if you say you're a veterinarian, like most of the audience instantly likes you, which is kind of good if you're, if you're trying to tell jokes and stuff. Kind of a good thing. So, and then they like the veterinary jokes. So, and then I was like, I think I want to do stand up for veterinarians. So I've been really lucky. I've been able to do I'm just starting, but I've probably done about 5 or 6 conferences where I've done stand up comedy, but for a veterinary audience, which is different, right? Like it's things that we start comedy, it's things we joke about. And I love both. I love going to a comedy club. Right now I do comedy almost every Wednesday at a club in Toronto called Yuck Yucks. Which is great stage time. That's not a veterinary audience, or I'm doing other shows around Toronto, or I'm doing stuff at a vet conference, it's different. The only thing about vet conferences, like they sometimes forget people like to have alcohol.
Yeah.
So I've done vet conferences like cocktail hour is after the comedy show. And I'm like, no, cocktails should be part of the comedy show.
Part of the comedy, exactly, before.
Yeah, because people need to loosen up to laugh, right? Especially veterinarians, because they're sitting there and it's usually not the best formation. Like for comedy to work in a club, like people should sit close together. It should be dark and they should have a drink in their hand. But anyway, I'm learning what to tell conference organizers too, as far as like what's going to work. But yeah, I usually do, like, honestly, it just varies where I am, but like 10-minute sets, that's kind of common, I would say. And then certain things I'm not like a big headliner. I don't want to overplay myself, but I'm just starting to kind of branch into that. So yeah.
Good. So you're taking it seriously. Are you going to make you're just going to write it and see where it goes, it sounds like.
Both. I mean, I'm the biggest nerd in anything I do. Like, so, like my friends just laugh because I went to Humber. I got like the academic award of excellence at a comedy school. Like I know I had perfect attendance. My average was like 92 or 93%, which is that's just how I roll. Okay. Like I'm a nerd. It doesn't matter.
But talk about study though. Here would be an interesting study though. My guess, if they did a true study, I bet the comedians that went to comedy school, the ones that got the worst attendance, probably ended up being the best, most successful comedians though.
No, because I have perfect attendance. No, I think it's just it is work. I will say, like, you don't have to have perfect attendance. I'm just a total nerd.
Right.
But
I get it.
What I think people don't realize, it's work. Like Seinfeld is. Yeah, Seinfeld's the best example. He did not he's known for having his pads and he would do a show, he'd sit down and write notes. Like it's a job. He took it seriously as if he was a lawyer, as if he was a doctor, like it was his craft. And so any successful comedian that you see, all the different styles, the people that have made it doing Netflix specials, I guarantee you, whether they went to comedy school or not, they worked
Yeah.
Like it was work, and they have worked so hard. And there's so many hours of stage time and so much writing time that is behind.
Right.
It looks natural. It looks like they're just doing it. But even Robin Williams, like he went
Right.
to theater school. He's an improv artist. Like he did the work. Even though when you watch his tapes, like you think, oh, he's just brilliant and he's just riffing.
Yeah.
He is, but it's because of his improv training. So yeah.
That's why it really is. If you ever want to get into comedy, watching the greatest comedians perform is the worst thing you could possibly do, because you don't understand. It's like watching ducks on water. You don't see the feet, paddling furiously underneath the surface of the water, and you don't see all the work that took there to get to that point on stage to be that refined. And then more importantly, the work that took to get that 60-minute special to where it's flawless. And the greatest comedians, like you can argue about their content or whatever, but I'm talking about in terms of delivery and their success as a comedian. Louis C.K., Chappelle, Richard Pryor, Robin Williams. You watch all the ones that you lump into whatever you think is the greatest comedian. It's just amazing the years and years that they took to get to that point of playing in the small comedy little clubs, and because they had to learn all the things that you don't do. And I think that's what people don't really see, and that's what I did. I didn't see, because I kind of made the same mistake. I just got up on stage and just started. I wrote a little bit, and I just started talking about my story. And I found that I'm a good writer, and I love the writing aspect of it, but it is a lot of work. It's a tremendous amount of work. And more importantly, you've got to put yourself on stage, because if you don't, it's just funny in your head. You'll never know what works and engages the audience. So how much time do you spend writing a week?
It really varies. Like it's, a thing will pop into my head and I'll write it into my phone. And then it may be something that I sit down and write, or it's just for later. Like I'm just trying to capture the thought or the premise or whatever I think is funny about it. And then I'll go back to it later. And then sometimes I'm more working on refining. So I'm on this, I always like a project. That's again, like I'm a nerd and I like a project. So right now I'm like working on, I see it. I'm going to be embarrassing myself because I'm probably not going to get it, but I like to have a winner mentality. So like Winnipeg Comedy Festival is a big comedy festival, and they will put out topics, and they want you to tape an 8 to 10 minute set on that topic. But it's not that I'm like, oh, I'm definitely going to Winnipeg, but I'm like, I like a project. So like now I'm trying to like put my material to fit with some of their projects so I can get a tape done by the end of October. I don't know. That's always the tough thing for me in my head, because it's like, you don't want to sound overconfident, because it's hard to get that festival.
Absolutely.
But then if you don't believe in yourself, we have a tennis star in Canada named Bianca Andreescu, and she wrote herself a check for, I think she was 15 or 16 years old. She wrote herself a check for $1 million. And she won, I think last year or the year before, she won the US Open or something. She won $1 million. Like she put it on her fridge. I'm going to win this. And then she did. And there's a lot of people who are hugely successful who've done that. Like they've kind of manifested it, like, I'm going to do this. I'm going to do this. So sometimes I get in my head and I'm like, I'm going to be on TV this year for my comedy, and it happens or doesn't, but it just, you sort of have to try to work towards something. So
I agree.
Yes.
Absolutely. And I am too. I'm working towards a 60-minute special. And I've always said entirely about dogs. I want to do a 60-minute special, the entire special about dogs. But I'm trying to challenge.
We have a lot of subjects for your content. That's for sure.
A lot of material.
I've spent
a lot of material.
I've spent over 3 years in tents and traveling on the road, staying with families with my Fuzzybutts by virtue of the foundation and backpacking after I lost dogs with cancer. So I do have a lot of material, but I got to tell you, I enjoy challenging myself now and trying to write stuff outside that's not about dogs. But it's a tremendous challenge. But I my goal is to be the opposite of Ricky Gervais. I want to be the anti-Ricky Gervais, because Ricky Gervais loves animals so much, and I love that about Ricky Gervais. I don't know if you like him as a comedian, but he's a huge animal guy. He's done
a lot. Yeah.
And he's a randy fella, and he's got his peccadillos, but he's a huge animal guy. And he's always talking beautifully about dogs and animals, and I kind of want to be the anti, and I want to be the guy that's always like kind of complaining about them, because it's interesting. I've always found on social media, one of the most interesting things about on social media is that when you have a big following of dog people, you can't really be funny and critical about dogs because it evokes such a visceral reaction that they don't know you're kidding. They don't know you're joking. And so if I ever joke about my Fuzzybutts online, I will get people that will unfollow me. I'm like, are you kidding? Do you know who I am? Of course, I love my dog. I love my Fuzzybutts. I would, they're like they're my reason d'etre. So it's a tremendous challenge, but that's what I personally want to do. I like what you said. Have a goal. My goal is to do a 60-minute special entirely about dogs and my travels with dogs and dogs with cancer. That's my goal.
Yeah, I think it's good to have a goal. That's what I do. It doesn't matter. Like you said, I'm just seeing where this goes. I'm having fun. I was talking about this. I think it's making me a better vet. So weirdly,
absolutely,
because it's sort of stimulating this other part of my brain. It's making me kind of creative. Things happen, and I honestly things are always happening that are maybe good or not good, but I can always see the humor of different things happening. I just laugh now. If something happens at work that's not great, a client interaction that's not great. I just had a client who, I don't want to give too much detail, but basically told me that they had sued their own, their personal human surgeon. As I'm taking their animals back to surgery, they're like, oh, just so you know, I had a major surgical complication and I sued my surgeon.
Oh, no.
And they were like, you can Google it. And I was like, okay, I don't know if they were I don't know. They were a really nice person, but it was just funny. But I find it hilarious. Everything was fine with the surgery. Their pet was fine. But I'm like, what's going on? Am I but then I find that hilarious. I don't know why they said that to me. I just want to share their story. They obviously had a hard time.
It's like cartoon balloon words out there in the space with the ... You can Google it. You're like, whoa, okay.
Yeah.
I find that hilarious.
I just went to I mean, of course, again, for me, it's always a patient first, whatever they're saying, because the clients can be amazing and they also can be challenging and they can also just be whatever. I find they really vary. The animals don't vary. They're always awesome, so they are, even if they're not behaving well or whatever, they're just being awesome. And so I focus on that. And then the clients, I hope that most of them are nice to me and appreciative, but that I'm not working for chocolates or cards. You know what I mean? I'm working for outcomes, and that's, and if people want to, I always like people giving me Starbucks gift cards. That's what I like. But but they don't have to. I don't care. I'm just whatever, if they're appreciative and their pet's good, that's fine. That's great. Yeah.
But there's, without a doubt, and I don't need scientific studies to demonstrate the validity of this assertion, is that what you're learning through writing comedy is making you a better practitioner, a better clinician, and helping pet parents cope and deal with the severity of cancer in their companion animal. And so because anything to help them make better decisions. So if you can lighten the mood, give them context, give them better context. Hey, there's hope. There's hope here. There's reason for hope. But even if there isn't, hey, your mate doesn't know. Your companion animal doesn't know you have cancer. They don't know the outcome, whatever. And that's not the most important thing. The most important thing is none of us know that. None of us are given that guarantee in life. And so we all have to do our best to live it all the most and the best that we can. And so what you're learning as a comedian should translate beautifully, I think, to working with pet parents, because they need that to make the best decisions, medical decisions for their kids. So it's very important. Humor, comedy.
Yeah.
It's like music. It's universal. It's universal. Everybody wants to laugh. Everybody wants to listen to good music, and everybody wants to laugh. It's our universal language.
Yeah, it's a great way to break tension. A lot of the maxillofacial surgeries I do can radically change their pet's appearance, and that is very difficult. And I showed you guys a picture of my dog. He's not behavioral wise, he's not perfect, but looks wise, he's perfect, right? And if I had a surgeon tell me I'm taking your animal's eye or part of their jaw, I would be devastated. I would be absolutely devastated to have to, but I try to remind people, I'm not disfiguring your dog. Cancer did that.
Right.
I am trying to help this situation. But also I tell people like, they don't care what they look like. And you have to have a sense of humor about what they look like, or you're going to be miserable. So
Yep.
I don't know. I usually joke around with people of like picking a new breed, because if their face is really altered, especially if I've like shortened their front of their face, or if they've done a surgery for like a nasal planum squamous cell carcinoma, I just tell them to like tell people it's a pug cross with whatever your dog is, or tell, because people will ask, like,
Right,
they won't even ask what happened to your dog. They'll be like, what breed is that? Because their face is shortened and their nose looks weird. And I'm like, make something up that you tell people in the park. It'll make you laugh every day. And so I'm not making fun of the dog, but I'm just trying to say, like, you have to have a sense of humor.
That's right.
As long as that pet is comfortable and cancer-free, and they can eat and drink, and they can breathe through their nose, it doesn't matter what they look like. And so you kind of have to let go. But having said that, like, I lost my heart dog to cancer 2 years ago. It's devastating. I mean, it was very hard to have a sense of humor about that, although I do some stand-up about that whole situation with time. Not right away. I had to have some time between that. But you've got to find, somehow you've got to find the
Ginger has,
Ginger has,
absolutely. Ginger has, I know you want to tell the story of Frankenbuddy, and because it's a very relevant story, and you're spot on. Go ahead, Ginger, please.
Yeah, it's so funny that you said telling people that you're going to remove their eye and part of their jaw, because that's exactly what happened to my dog, Buddy. And I remember Dr. Mann at the University of Missouri, he came in, he was telling me, explaining to me, he was so nice. And he was like, I'm going to do the best I can, to retain his good looks. And, and I was like, I don't care what he looks like. It's not his face I'm in love with. It's his soul. And as long as I have his soul, I'm a happy camper. But Dr. Mann was so sweet. I mean, he took all the time to explain to me everything he was going to do. And then he returned me. I get Buddy, and literally we nicknamed him Frankenbuddy, because he had staples going, like, I don't think they put staples in his eye where they had to remove his eye, but down his jaw, he had a feeding tube in him.
Yeah.
And all this happened to me like right at Christmas time, and they luckily released him at like midday Christmas Eve, so I could make it home for Christmas, because I wasn't leaving, And then when I took him to the vet, the day after Christmas, for a follow-up, everybody in the waiting room, they were just like, and I just looked at them, I said, you should see the other dog, I mean, I had to make a joke out of it, and we named him Frankenbuddy and Biscuit Head, because the only thing I could get him, the first thing I could get him to eat after the feeding tube was a Chick-fil-A breakfast biscuit, with the chicken on there. So he was Frankenbuddy and Biscuit Head. So it was, but yeah, but
that's how you have to deal with it. Honestly, you have to deal with it that way, because otherwise I've had people, not quite as dramatic, but even not a very dramatic surgery, but even just having your dog's face shaved, even if I just took a dog to the back and shaved their face and didn't do anything else to them, it looks weird and it's upsetting, right? And so now there's an incision, and my incisions are always way bigger than people thought they were going to be, because I'm trying to cure their dog's cancer. So I have to coach them, be like, this is going to be a big incision. Your dog's going to be really shaved, but that is upsetting. Even if the dog isn't disfigured, they just have a huge shaving and a big incision. That is upsetting for people. That some people almost pass out when they see that, because it's so upsetting to them. So, they need to get through that, but then just trying to find a way to be like, okay, like my dog has to wear a sweater for a few months, or my dog is Frankenbuddy, or, whatever it is, it's not that it's funny, because it's not. Your dog has cancer. It's not funny. There's nothing funny about that, but it is kind of funny how they act. They're just like, hey, how's it going? They're just like, I love watching them see their owners again. Like they're wagging their tail. They look ridiculous. They're like, they got their cone on their head, and they're like, hey, you came to get me. And they're, I think that's a good thing for people to focus on if they're going through that with their pet, is like, look at your pet. Are they happy? It doesn't matter what they look like. Just don't worry about it. I had a client who I did a really big surgery for a maxillectomy for fibrosarcoma. And this dog had just a ridiculous ear. Like one of them just like, oh, this is good that it's video. One went straight up and one went like straight out. And it was like the thing she loved about her dog. So we talked about the surgery, and she's like, as long as you don't touch his signature ears, I don't care what his face looks like. So he kept his he kept his funny like signature ears, and she got a tattoo of him with his changed face and everything, and he did really well. And she literally couldn't have cared less. Like, she's like, to be honest with you, if the signature ears had to go, she would have dealt with it. But that was her thing. And it was his, like, it kind of was his funny personality too, with this like super, like, I don't know why his ears were like that, but yeah.
I know. Yeah. That's hilarious. I write a lot for that reason, the people I talk to and going through it, and to be able to use that, to use humor again, because as you said, it's not funny. But I'm right now in my writing, I'm particularly interested and focused on people who say, I wish I could talk to my dog. And I find that very interesting. And we now are witnessing that actually may occur in our lifetime. Elon Musk is working on Neuralink, when he hopes to create some type of communication interface between species. And so in writing, I'm working on a bit right now. I'm like, yeah, but do we really want that? Do we really want to talk to dogs? Let's just take this one example. Let's just say that it's time for me to neuter my boy Hank. And so Hank and I, let's game this out. Hank and I have to sit down and have the conversation. It's time to get him neutered. Well, what do you think Hank is going to respond? He's like, please, Bobby, don't, I'll keep in my pants, Bobby, don't. Think about that. If pet dads could talk to their pet sons, to their kids and stuff, and have the adult dad to son conversation about neutering, what do you think would happen to spaying and neutering in this country? It would drop like almost 100%. There wouldn't be a single pet dad in this country that would take his boy to get neutered if he could have a conversation, right? If he could talk to his dog. So I'm not sure.
Yeah, because men already have a hard time.
They already do. Yeah, I was going to say,
done. Yeah.
When I was in primary care practice, I always had to remind those owners, I'm like, I'm not neutering you. Just neutering your dog.
Exactly.
Yeah, they have a campaign down here in Tennessee educating, I guess, country boys of it's okay to neuter your dog or something like that. But I'm like,
I love that.
But I'm like, it's okay. But I swear, if he tells you, no problem. I promise I won't do anything. I'll be the best boy. Yeah, no, I'm not neutering if I have to have that conversation with my boy, I'm not neutering him. So we don't want. So it's interesting but that's interesting because you actually have people like techno billionaires trying to do all these weird things with technology, and you think about it, nobody ever thinks it through. Like, well, maybe we don't want that. I don't really think we want to talk to dogs. Maybe we want to be able to communicate them, but not communicate 100% with them. Have like a fluid conversation, right? With
them.
Do
I really want to know what Lily has to say?
Yeah,
I can pretty much figure it out on my own, but yeah, there are some aspects to that bark I don't understand, and I probably don't want to.
On my Instagram says that I talk to dogs, and I'm like, yeah, I do. There you go. I do. I don't need Elon Musk. I talk to them. I talk to my patients. I can walk around my cages. I'm like, you need to pee. You're painful. You need to go home.
That's awesome. I have met people with that skill. It's unique. I wish I had that. I look at my boys, and we just kind of look at each other like, what do you want? They look at me, what do you want? We're typical father-son with my boys, and so I don't understand them. I'm sure they don't understand me, and they're certainly not grateful for me. And that's why I don't want to talk to them, because I would have a hard time going to work and working my arse off to make sure they get the best medical care and the best food available if I had to talk to them. If I had to come home and they gave me lip every day and they gave me a hard time.
and if they told you, oh, Poppy, I love Mommy G more.
That's right. It's like, all right, well, she can do everything. Yeah. So anyway, that's what's so great about companion animals is when in comedies, when you think about it, there's just so much material out there. In fact, actually, you being a veterinarian, you probably have source material.
Yeah, the Cageliner was funny because I would literally, something would happen and then I would write it in my phone and then I'd go home and write a Cageliner headline because I was like, oh yeah, that's funny. Like that's, again, like a light threat as you're heading to take an animal's pet to surgery or whatever it is. Like, yeah, which that was I was having a hard day that particular day. Like I had 3 clients in a row that for various reasons, I don't know why, it doesn't usually happen, but just were giving me a hard time. I'll say that. So yeah, that's where I need humor, and I'll write some stuff down for the Cageliner, which I promise I'll revive soon. But yeah, it's you've gotta find a way to laugh about that stuff.
You do, and humor and music make the world. They keep the world moving, I think, and keep everything kind of glued together and sane in this insane, increasingly insane time that we're all going through. And I think that's what companion animals. We have so much. We're running a little bit long. My apologies. There was a couple of things I wanted to get to, which we'll save.
All right, let's get to it.
Because there's like AI and AI, the rise of AI. That was really cool, interesting. Other things, comedy things we could do, but we're running long. So before we go, Dr. Boston, was there anything that I left off the list? I mentioned, please plug your wonderful book. I haven't had a chance to read it yet. Lucky Dog, and you talked about it briefly, but please mention that for a second.
Yeah, okay. I'll tell you 2 plugs. Thanks for that. So Lucky Dog, How Being a Veterinarian Saved My Life came out in 2014, which I almost can't believe. It's a book about me and my own kind of journey with having thyroid cancer, but it's also half of the book is about patients that I treated that have cancer. So it's a lot of people who have animals with cancer really love this book. It's funny. Also, cancer survivors have really reached out to me that they also really like this book because they, the feedback I get is they take it to their medical appointments. They sit there and read it while they're waiting. And I think that's cool because I feel like, I'm keeping them company. I'm telling them jokes in their ear while they're sitting there going through that stress. So I find everyone gets something different out of the book. So there's the thyroid cancer community that, it's kind of explains what's going to happen to you. And then there's just the larger survivor community. And then there's people with pets. So it's been interesting to me because it's a piece of art that's out in the world, and people will take art and put their own meaning on it, their own spin on it, which is exactly what art's supposed to do. But I think for this, like for your listeners, it's really like if you have a pet that's going through cancer, if you're trying to make decisions. I've had people say they read the book and it helped them make a euthanasia decision, which I don't know, I was gonna say that's really cool. It's not really cool, but if I can help people with that, that's really cool. It's just being able to help people. So yeah, that's Lucky Dog. It was like one of the most joyful things that I've done, is having the privilege to publish and write a book. And then it honestly, that like pushed me on this creative path. So it was like the book, and then it was like comedy and comedy writing. And now my little summer project, which has been, as you know, I don't need to tell you, podcast is a lot of work, but I started a podcast called Comedicine, and it's really me trying to get to know these weird people like me who are healthcare professionals who also are comedians. So it is, I'm the host, and it's not just veterinary because that's too small a pool, but it's like nurses, dentists, doctors, and veterinarians and veterinary technicians. So really anyone who's working in a healthcare space, and I'm open to everyone, like paramedics, everyone. Like I'm kind of collecting all the different professions. I just found a nurse and a veterinary nurse, and I've got a dentist that I've interviewed. So any of the healthcare professionals who are also comedians, talking to them. And it's been, the joy I felt writing the book, I'm feeling that again for the podcast. It's just been fun to create it. And I'm meeting amazing people, which is super fun, just on its own. Like, even if that's all that happens with the podcast, that's great. So yeah, that's Comedicine. It's not just for I think it's for lots of different people interested in comedy, second careers, midlife crises, people who like just listening to comedy podcasts or healthcare podcasts. So yeah,
I listened to your second episode. I didn't listen to your first one. You had the comic. There was a comedian on from Florida, I think, on your second.
Yeah, Vian
comic doc. I think it's a comic doc.
Yeah. And it was so cool because I love that interview because he's just a lovely man. I didn't know him before. He's like, yeah, I'll be on your podcast, and just so many parallels between my profession and his profession he's an ENT doctor. Mm-hmm. That was really interesting to me, that he was like, my job was swallowing me whole, and I needed to do this other thing. And I was like, oh yeah, I can relate to that. Because it is, as much as I love being a surgical oncologist, and I don't think I can imagine doing anything else, it can eat you up. Like you suddenly, all your travel is conferences, and all you're doing is writing papers and answering emails, and then clinical work. And it's just like, the list will never end of things that you feel like you should be doing or can be doing. And sometimes you have to just try to cut it off, be efficient, and find something else that's going to kind of make you a whole person. So that's kind of in a nutshell what it's about. But it's been super fun.
Yeah, and we're going into this is the second year of our podcast, and anytime you start something, you have the dreams or aspirations, I guess, of scaling a lot faster than the reality of what it happens. But the truth is, when you grow something and you're trying to build an audience, I just don't even think about it anymore. I just think about it. As long as we have good people that have some good, interesting things to say on there, we're going to reach an audience. And like you were saying earlier, you don't really know the net result of it. But at least people that are going through whatever, that read your books or listen to your podcast or benefit from your creativity, at a bare minimum, you help people that are going through a tough time feel less alone. And that's a really important thing. That's a really important thing, because it's a very lonely world that we live in, especially when we have a loved one going through cancer, and we have to make very, very difficult medical decisions on behalf of a loved one, which is it's really a tough thing to do. So to help people that are going through a tough time feel less alone throughout that it's very valuable. So
thank you. I wanted to share one more thing with you guys, because I have
Sure.
it right here. So this is that's Rumble. Can't see it very well. That's Rumble. So I lost my dog to cancer. He was 8 years old 2 years ago, and
his name was Rumble.
Rumble. Yeah, he's on my book cover. He was an amazing dog, incredible. He was like, everyone thought I was such a good dog trainer because of this dog, but apparently that's not the case, because Earl is testing me. So he was just an easy dog to train. He was amazing. And he had gastric carcinoma that was not resectable. So he was an insured dog with an owner who was a surgical oncologist, he was my heart dog. I would have done anything for him. And just sometimes that's all you can do is euthanize your pet. And that was very, very challenging thing to go through, but it changed how I interact with my clients now. Like, I know it's not like I've lost pets before. I've had pets my whole life, but losing a pet at 8 to cancer and feeling that helpless definitely informed, my understanding of how people feel. It's devastating. It's absolutely horrible. And sometimes it is true. There's nothing. I would have done anything. Like, I had insurance. I probably would have remortgaged my house. I would have been one of those people who's like, I don't care. I don't care what it costs. I don't care. But people should get insurance if you don't have insurance. But
yes, insurance.
Get insurance. But he was a insured pet. Owners, both veterinarians. I'm a specialist. And sometimes honestly, it doesn't matter how much money you have. It doesn't matter if you have the best specialist. It doesn't matter, because a cancer is going to win, and you have to focus on making your pet comfortable and letting them go. So yeah. So anyway, I just wanted to share that, because you guys were sharing stories about your pets.
I'm sorry that you lost Rumble. How old was he?
He was 8. Yeah.
So young.
Very frustrating. Yeah. So yeah, and a lot of my clients will say that, right? Like, if their pet's 12 and has cancer, they can kind of get their head around it a little bit more. When they're 6, 7, 8, it's just like, it just feels like I wasn't ready for that. You know what? That's not like, you have in your head. Well, we forget, because we like to forget that our pets die, but you have in your head, okay, they're going to live to be this old, but sometimes no, right? And sometimes you get sort of like a curveball thrown at you. So I love what you guys are doing. On both sides, I have a good understanding of what dealing with cancer and pets is about.
I think that's important. I've met veterinary oncologists that on both sides. I've actually met veterinary oncologists that don't have companion animals, which I thought, why be a veterinarian if you don't have pets? I don't trust veterinarians that don't have pets.
I can speak to that. Like, I've always had pets, but sometimes we're so busy. So that I don't know why, but
it's not fair.
It's not fair that you're a vet. I mean, I've had that as a vet. I've always had pets. I will always have pets, because I was without a pet for 6 months when my dog died, and I was like, why do people do this? This is miserable. I was like, I do not have a dog.
Yeah. I do think if a veterinary oncologist has gone through their own kid going through cancer, it changes them. It changes them a lot, and I think that's important. I think I don't wish that on anybody. I've never. Please don't misunderstand me. But
no,
they achieve an empathy with pet parents that veterinary oncologists that have not lost a companion animal to cancer, they don't understand, and they treat it as they should, scientifically, surgically. in the sense that we're just addressing a problem to which that there are several treatment options, and those treatment options have potential outcomes, and that's how we're going to deal with it. So there's that level of care, and then there's the care of, I've been through this before, I know what you're going through. Let's walk through this together. So there's an empathy, and it's an unfortunate. We're a fraternity. It's a very unfortunate fraternity. All of us who've lost companions to cancer, and actually it's a global fraternity now. That sounds sexist. What's the sorority or whatever? It's a global.
Oh, that's okay. Family.
Our foundation. The first tagline for our foundation was "Cancer touches everyone," and that's what I'm trying to get at. Is that there's not a single person in this world now that has not been touched by cancer, and but at least with companion cancer, having a practitioner, a clinician that's gone through it before, it does make it, and keep things funny. So please keep that up, because there are pet parents. There are the times where pet parents, I'm sure I can speak for many pet parents, where they just don't know if they can continue with the pain and the stress and the sadness. So I speak about that personally. So Ginger, I'm leaving things. I can't leave things on a sad note. This is a comedy cancer. We gotta leave it on comedy. Okay, Dr. Boston, do you have any jokes for us? You don't seem like a yuck.
No, I knew you were gonna say that. Tell us a joke.
You don't seem like a yuck person, though. You seem like a storyteller.
I like both. Yeah, I don't have
tell us a joke then.
Oh my God. I'm trying to think of a dog joke. Oh, I can tell you. Yeah, I can tell. I mean, I sometimes open. Okay, I'll tell you a joke. This is how I sometimes open if I tell people I'm a veterinarian, and I say, oh, people know I'm a veterinarian, and they're always asking me for free advice or free ketamine. But I'm a professional, though. I would never give any of you free advice.
Yeah. That's awesome.
Actually, I do have a few little. Anyway, no, that's like
that's really good. I really like that, actually. Because you can go different directions, because there is an epidemic. I think it's pretty small. Hopefully, God help us, it's small, of pet parents that actually injure their animals to go on and see the vet to get access to drugs like tramadol. So you could take that and sort of. There are all different directions you could go on.
There's some dark. We can go to some. Veterinary medicine has no shortage of dark places we can go. So
absolutely. All right. Well, I got to come see you live. Do you post do you tour? Do you have shows that you post on your website?
Yeah, I'm not quite there yet. I put stuff on Instagram, though. People can find me at Dr. Sarah Boston.
What is that again, please?
It's Dr. like DR and then SARAHBOSTON. That's my Instagram. That's probably the best.
Dr. Sarah Boston with an H is where they can find
Sarah with an H. Oh yeah, I know. I thought that was gonna be so simple, but you're right, because it's like, do you spell it out? But yeah, it's just DR SARAH and then Boston. It's probably the Instagram's the easiest way to sort of figure out what I'm up to.
Okay.
Yeah.
Good. Well, I'd love to come see you, and as I continue on my comedy adventure, wherever will take me, I'll share some stuff with you and see if you like it.
Amazing.
Because comedy is one of those weird things, is that it's very particular to the individual, but it's universal. So I'm curious to see what you think when I get to that point. Well, thank you very much. Did I get everything, Dr. Boston? Did we cover? I hope we did.
I think we did.
Okay, good. I think I'll
hang up and I'll think of something, but no, I think we're good. Good.
Well, the good news is you always got stuff going on, so you are more than welcome to come back on Fuzzybutts and Friends and update us with your current latest passion project. And at some point, when I become better known as a funny man, I'd love to come on your podcast.
Perfect.
Your Comedicine. Well, I guess.
Comedicine.
Well, was it only for healthcare providers that are comedians? Did I get that? That's
kind of how we started. Yeah, I mean,
okay. Well, certainly not healthcare.
Into something else. It can morph at some point, but yeah, right now I'm trying to. I was only going to do stand up, but I have a couple improv comedians coming on.
Excellent.
But yeah, that's kind of like. I'm trying to focus, and then you know it's a podcast, so who knows what's going to happen.
It makes sense. It's trying to keep humor within the medical community, so it absolutely makes sense. And I'm certainly not a member of the medical community, so don't confuse me.
You're Jason. You're medical adjacent.
Ginger, I've screwed up a lot on this episode. Don't kid me. We've had a lot of comedy, Ginger, going on here today. Don't kid me. I screwed up a lot on this episode. How bad did I do this time?
Not too bad.
All right. Well, I'd ask you for a cancer tip from the Puppy Up Foundation, but I think we've been talking about cancer a lot. So, Are we going to forego the cancer tip this week?
Well, I actually have somewhat of a cancer tip, and it has to do with arthritis and osteosarcoma. So Scooter, my dog Scooter, was diagnosed with arthritis. And, we got x-rays of him, periodically. And I just thought that his arthritis was getting worse, and wound up getting another set of x-rays, probably just even 8 months after the previous set. And he wound up having osteosarcoma. And as you know, Luke, I wound up losing him really maybe within a week, probably 4 days from that. But one of the things I hear that pet parents say is, oh, my dog has arthritis. And I'm like, well, did your veterinarian take x-rays? And they're like, no, he was limping, and we put him on this arthritis medicine. And yeah, they might do that, but the other thing is your dog could actually have bone cancer, and your vet's treating it, if they haven't done any x-rays, that they're treating it initially as arthritis. And time is of essence, especially with bone cancer, because it can metastasize to the lungs. And with Scooter, had I known then what I know now, I probably would have had him, those x-rays taken after he was 12. So after 10, I probably would have had x-rays done on him every 6 months, probably 4 to 6 months. X-rays they're not cheap, but it's and if you get insurance, it'll cover that. But don't just let your veterinarian say, oh, your dog has arthritis. Make sure you have x-rays done of that dog, especially, even if your dog does, you get the x-rays and they show that it's arthritis, but make sure that those x-rays are taken, especially if the dog starts getting worse.
Yeah,
it's actually pretty common. That's a pretty common scenario of because they are, a lot of them are large breed dogs that are older. So a lot of them do have arthritis.
Right.
And
exactly.
Is it asymmetrical? Is it progressing rapidly? Do they have arthritis is painful, but it's not that painful. So is it like, oh wow, this dog is off their leg and rest doesn't seem to help? It's pretty common for veterinarians to try a trial of a non-steroidal and some rest for about a week. That's fine, but then it should get better, right? So I think that's where you sort of stay on top of it. If it's not making sense, usually arthritis is usually symmetrical. It usually affects both knees or both hips, or both elbows, maybe to different degrees, but usually, unless it's an acute cruciate tear. So, but if it's an acute cruciate tear, they should have x-rays. So, if things are not symmetrical, they should get worked up. If things are progressing rapidly, they should get worked up. It is very easy to say, oh, it's an 11-year-old dog, they just have arthritis. They probably do. That's the thing. They probably do have arthritis, but is there something else going on? So
yeah, it's a good tip. He had a kind of started out a bad start in life. When he was about 10 weeks old, a 15-year-old girl broke his leg with a baseball bat. So he always had issues with that leg. And so as he got older, it got, worse. And he was a big dog, like you said. But yeah, when I realized his pain was dramatically different, and then I had those x-rays done, it was too late to do anything.
Yeah, I'm sorry about that.
Yeah, it's good advice in the sense that don't assume that even if your dog is responding favorably to NSAIDs, don't assume that it's without an x-ray or proper diagnostics. Don't assume it's this arthritis. It could be something worse. So do the diagnostics, and if you get the diagnostic, if you get the diagnosis, go see a board certified veterinary oncologist. That's the way I'm going to leave this.
Yeah, we're going to leave on an up note.
And then if you do get the diagnosis of cancer, have fun and laugh around your kid. That's the most important thing, because your kid doesn't know what.
When we get off this, stay on for just a couple minutes, okay?
Okay.
Thanks.
I was about to make a joke, and the worst thing you could do a comedian is step on their joke, Ginger.
Well,
It's okay.
hey,
Not
but
this
good
season. All
comedians can
right.
pick it up and go on.
Oh no,
Right.
yeah, you're good. You're good. All right, so let's go ahead and wrap things up. We ran a little long, guys. We had a lot to cover. Thank you for being here with us this time. This week we drop every Tuesday. You can find Fuzzybutts and Friends on your podcast platforms such as iHeartRadio and Spotify. You can also watch us see Dr. Sarah Boston live in real life on our YouTube channel. That's at fuzzybuttsstudios.com. I'm sure you'll be seeing Dr. Boston again because my adventure in comedy has just begun, and I look forward to seeing her and watching her live on stage somewhere along my travels. So we'll see her again. Thank you, everybody. We'll see you next time. Puppy up. Talk soon.